Ultrasound machines have a number of buttons, knobs, or toggles that allow you to adjust or optimize the image on the screen. The most important functions to optimize the two-dimensional ultrasound image are depth, frequency, gain, and focal points. Study the owner's manual for your ultrasound machine to see how to access and use these functions. Most ultrasound machines have buttons, knobs, or toggles to allow you to increase or decrease depth. As you adjust depth, there is also a numbered grid on the right or left side of the ultrasound screen showing the current depth of the ultrasound beam in centimeters. Find and study this function on your machine. Abdominal ultrasound is a study of individual organs and structures. Veterinary patients are not all the same size, and neither are their organs. To study an individual organ, you increase or decrease depth to fill the ultrasound screen with that organ so that you can concentrate on the organ of interest. For example, in small dogs or cats, you may have to decrease depth to magnify the liver to fill the screen. In large dogs, you may have to increase depth to see all of the liver. By filling the ultrasound screen with the organ of interest, you make all organs the same relative size on the ultrasound screen. This will make it easier to recognize abnormalities. Manipulating depth to fill the ultrasound screen with the organ of interest also increases the amount of detail you can see. For example, this kidney, seen at great depth, does not show much detail. If you decrease the depth to fill the ultrasound screen with kidney, the image of the kidney is magnified and you see much more detail. Most ultrasound machines have buttons, knobs, or toggles that allow you to change frequency of the ultrasound beam. Current frequency of the ultrasound beam will be listed somewhere on the ultrasound screen. Find and study this function on your machine. Some ultrasound machines adjust frequency for you as you adjust depth. Low frequencies with low numbers in megahertz allow deeper penetration to see deeper structures of the abdomen, but produce a coarse or grainy image with less detail. High frequencies with high numbers in megahertz do not penetrate deeply and are best for shallow depth. High frequency produces a more detailed image. As you change the depth of the ultrasound beam, you may need to change the frequency. Higher frequency for shallow depth and lower frequency for deeper depth. For example, at a depth of 2 to 4 centimeters, you may want 8 to 10 megahertz frequency. At a depth of 4 to 8 centimeters, you may want a 7.5 megahertz frequency. At a depth of 10 to 14 centimeters, you may want 5 megahertz frequency. As you change depth, you adjust transducer frequency appropriate for that depth. Some ultrasound machines adjust the frequency automatically according to the depth you select. Gain is also known as power. Most ultrasound machines have buttons, knobs, or toggles that allow you to increase or decrease gain, affecting the entire screen. If the ultrasound image is too weak, you can increase gain on the whole screen. If the ultrasound image is too bright, you can decrease gain on the whole screen. Operation and design of ultrasound machines are based on a number of assumptions. We will cover part of those assumptions. The transducer sends out and receives the reflected sound waves from soft tissue. The machine assumes that the speed of the transmitted sound wave is the same in all soft tissue. That is 1,540 meters per second. The machine constructs an image of soft tissue at various depths depending on the time it takes sound waves to return to the transducer. Next, the ultrasound machine assumes that the sound waves will pass through and be reflected from tissue of the same echo density. This is mostly true if you are imaging an enlarged and homogeneous liver. Next, sound waves are partially absorbed by the tissue they pass through. So, as the ultrasound beam passes through deeper and deeper tissue, the reflective wave is weaker and weaker according to depth. Therefore, our image of an enlarged, homogeneous liver would be strong in the near field and become weaker and weaker toward the bottom of the ultrasound screen. So, to display an image of a homogeneous tissue, the reflected ultrasound return from deeper areas must be enhanced to match the echogenicity of shallow depths. TGC toggles are time, gain, compensation toggles. Each toggle controls gain at a sequentially increased depth of the ultrasound screen. Pushing a toggle to the right increases gain at a certain depth. Pushing a toggle to the left decreases gain at a certain depth. Use of the toggles allows you to compensate for weaker returns reflected from deeper tissue. From top to bottom, if each toggle is placed a little further to the right than the one above it to compensate for the weaker return, the appearance of a homogeneous tissue will be the same from the top of the screen to the bottom of the screen. Some ultrasound machines do not have TGC toggles, but automatically adjust gain according to depth. In reality, the patient's abdomen consists of a number of different organs of various tissue echo densities. An example is a view of the liver and gallbladder. The normal gallbladder is anechoic, or pure black. This means there is no echo, or no reflection of ultrasound waves from the area of the normal gallbladder. It also means that the ultrasound wave passing through the normal gallbladder is not weakened. A number of artifacts may occur in the gallbladder and the liver dorsal to it because the ultrasound waves passing through the gallbladder are not reflected or absorbed and not weakened. Use the TGC toggles to reduce gain in the area of the gallbladder and the dorsal liver to compensate for the artifact. Some ultrasound machines do not have TGC toggles, but instead have 3 knobs to control gain. One knob controls gain in the near field, or upper half of the ultrasound screen. The next knob controls gain in the far field, or lower half of the ultrasound screen. The last knob controls overall gain, or gain of the entire ultrasound screen. If you have an auto gain function on your machine, you can press this button to return to factory gain settings. If you do not have auto gain and feel that your gain adjustments have hopelessly altered the ultrasound image, you can turn your machine off and then turn it back on again. As your machine reboots, gain will be reset to original factory settings. Focal points are used to improve image quality at certain depths on the ultrasound screen. Some ultrasound machines require the operator to set and place the number of focal points desired for every image. The operator should constantly adjust the focal point, or points, to the areas of interest on the ultrasound screen. The operator must also choose the number of focal points to use. Some ultrasound machines offer from 4 to as many as 12 focal points. As the number of focal points in use increases, the frame rate of the ultrasound machine decreases, causing a slow motion image with increased motion artifact. With this machine, note that as the focal points increase from 1 to 2, the frame rate decreases from 38 to 20 frames per second. As the focal points increase to 4, the frame rate decreases to 10 frames per second. In abdominal ultrasound, it is best to use 2 or 3 focal points. Focal points should be placed at the bottom and center of the target organ or lesion. Some ultrasound machines automatically control the number and position of focal points for you as you increase and decrease depth. Placing the organ or target you are viewing in the center of the ultrasound screen and holding the transducer perpendicular to the target when possible reduces artifact. Let's use the spectral Doppler cursor line to help us practice centering targets. Remember, the index indicator is on the left side of the ultrasound screen. If the target, in this case the stomach, is to the left side of the ultrasound screen, it is in front of the index indicator. To center the target, move the transducer in the direction of the index indicator. If the target, in this case the urinary bladder, is on the right side of the ultrasound screen, it is behind the index indicator. To center the target, move the transducer away from the direction of the index indicator. Like a video camera, ultrasound machines construct a number of images or frames per second. Most ultrasound machines will store the most recent 75 to as many as 250 or more images in memory during scanning. When you press the freeze button, you can use the cinematic loop or Cine loop to scroll backward or forward to find the best image, make measurements or annotations, and save that image to a permanent storage file in the patient record. In addition, if an animal is struggling, you can use both hands to stabilize the transducer and then press the freeze button and use cinematic loop to scroll backwards to find an acceptable image.